people in as they get here. Good morning, everybody. Well, there they go. All right. It's 9 o'clock, so we're starting right at the top of the hour. And good morning, everyone. I'm here with Dr. Melissa Balizan. And for those of you that join us regularly on Tuesdays, you'll know that on Tuesdays, our members come forward and they teach on their genius. So each one of our members are geniuses in their own area of expertise. And Dr. Melissa Balizan, a good friend of mine, a client I work with, she is an expert in Eastern and Western medicine. And what I love about what she does is she is so different than a doctor. And she's going to talk a little bit more about herself, but she's so different because she gets to the root of the problem. And what doctors do is just Band-Aid, Band-Aid, Band-Aid. Here's another pill. Here's another pill. And no one realizes this $1 trillion business is killing us, the industry of all these pills that we're taking. So I'm going to go ahead and let Melissa jump in and get started. But I wanted all of you to know that if you are interested in having this type of stage where you have the opportunity to come here for 45 minutes to 50 minutes and teach your genius, we promote you. We send out all the emails. We promote you on social media. And then you have the opportunity to come and teach this workshop, take that workshop that's recorded and utilize that on YouTube, in any of your training videos that you may have on your website. So this is a great opportunity for you to not only get more exposure, but then have that credibility in your pocket as well that you might not have had before. So welcome everybody this morning. I'm going to go ahead and turn my time over to Dr. Melissa Balizan. Welcome, Dr. Melissa.
Thank you, Colleen. I am so honored to be here and be able to share with all of you ladies today this incredible information. And I'm going to go ahead and share my screen. Okay. Can everybody see? Can you see my screen?
Yes.
Okay. So there we go. So today, I titled this The Vital Piece. And as we go throughout this, I'm going to ask you a few questions along the way. And so be sure and put your information in the chat. And then if you do have questions that come up, please put them in the chat. And I know Colleen's going to help watch the chat for me and help me so we can get to those questions. I'll try and answer them along the way. And then there'll also be a little bit of time at the end as well. So we'll ask, what is the vital piece at the end? But stress and your health. What you may or what you don't know may kill you. I forgot how I worded on this one. What you don't know may kill you. And I don't say that lightly because there's a lot of things out there that could cause harm to us. And so we're going to go through today. Our objectives is we're going to talk and we're going to learn what really is stress, why your health matters, what is the root cause, and what are your next steps. And so just a little bit before we get started further, Colleen introduced me with kind of my bio, but to let you know a little bit more about me. I'm the eldest of 3. I have now actually 4 nieces. That picture is a little outdated. We need to meet again and get another picture because the baby there is now 3 years old. And then my little doggy Chestnut, who is actually right next to me. She's always next to me. And then I live in Colorado, which is a beautiful state. Come and visit me. And my wonderful husband of 20 years, Edward. So what does the World Health Organization have to say about this epidemic we call stress? Well, it says that depression is the leading cause of disability and that stress has affected more than 350 million people. That's a ton. I think we need to do something about it. So how are we going to do something about it? Whoops, sorry about that. How do I go backwards? My apologies, technology.
There's an arrow at the bottom of your screen.
I didn't see the arrow, so okay, here we go. Sorry about that.
That's okay.
Uh-oh. Okay, here we go. What is stress? So stress, what is it? It is actually defined as the internal wear and tear on your body. It is your fight or flight syndrome. So when you are attacked by something, or there's a fire, or there's your child's in the street and there's a car coming, your instinct kicks in, your stress response kicks in, and it causes you to fight or flight, which sometimes we flee. So sometimes we're ready to run out there and we're going to grab that child, or we're going to grab our dog and we're going to get him out of the way. There's a fire, typically we're going to run away. Sometimes situations, we want to just sit there and freeze. Sometimes we faint. These are all responses to the stress system. Now with stress, what happens is that our bodies go into this state. And over time, we need to have time to recover from stress. And if we don't recover from that stress, it just keeps accumulating and accumulating. And it actually takes 24 hours for women to reduce and come out of that stress response, which means we're pretty much constantly in stress response, which is not good for our bodies. Now, men, they come out in about 9 hours. So something else they have. Okay.
Can I share a quick funny story? Do you mind, Melissa? So,
go ahead.
Okay. I like TikTok and like to get on TikTok every once in a while because there's some cute videos on there. I saw a video yesterday of a lady. There was a bear and 2 cubs walking across their back wall. And the guy is screaming, "Mom, mom, get the dogs." And the dogs go running out in the backyard. And the bear's reaching down to try and attack the dogs. And the dogs are like jumping up, trying to bark at them, right, to get the bear. The mom goes running out back. Okay, this lady's like in her rollers in her hair. She has like her nightgown. She goes running out back. She pushes the bear off the back wall. I am not kidding you guys. She pushes the bear off the back wall, grabs the dog because he was trying to grab, he was reaching over down to grab one of the littlest dogs, pushes the bear over, grabs the dogs, and runs back in the house. I was like, that to me was like that fight or flight. You know, she just didn't even think about it. She ran out there and her stress levels were like, she just fought a bear to save her 5 dogs. Like, if that's not the best story that goes along with this, and you know, it took her 24 hours to like come down off of that and realize what had just happened in her body. Like that, I just wanted to share that story because it blew me away. And I still can't, I always think, what would I do in that situation? What would I do in that situation? You know, you don't know until we're there, right? And then we have to make this quick, sudden decision. So I just wanted to share that real quick, Melissa.
Thank you for sharing. And that's exactly what the stress response does to our body. So that was perfect. If I had known, maybe I would have thrown that video up. So sometimes stress is not that dramatic. Okay. So it can come on more subtly and it can show up in different ways. These are just a few of them. We might notice fatigue. You just don't feel quite right. You have that uneasy, queasy feeling in your stomach. Maybe you have sweating. Maybe your heart's racing. Maybe you have a panic attack. Maybe you get a rash or acne. Maybe you have a headache. These are different ways that stress can show up, and it's your body is telling you, hey, something's quite not right. Let's pay attention. And what we often do is, like Colleen said, we put Band-Aids on things. We try and treat the symptom. These are symptoms showing up of stress, and we mask them down with medications. And we'll talk a little bit more about that. Stress assessment. So you can do a stress assessment on yourself. There's questionnaires out there. When I work with my clients, we go through a stress assessment. Your digestive system, when your digestive system isn't working quite right, so you have that upset stomach, you have heartburn, you have diarrhea, constipation, all those fun things we love to talk about. Your body is not able to nourish itself and in order to take the nutrients from the food that you're eating. So that could be a stress response. Your immune system kicks in when stress kicks in. Men and women are different. As I said earlier, the stress response cycle is shorter for men. And acute versus chronic stress. When we're constantly putting ourselves under the same stress over and over and over, then it becomes chronic and it could lead to be given a diagnosis such as anxiety, depression, acne, back pain, migraines. These are just a few. Now, the acute stress would be just like that bear example. That's an acute response. We're probably not going to run after and grab our dogs away from a bear every single day. If you did that every day, that's going to be a chronic thing. But these are just a few things. You can kind of just take a reading and tune into your body and see what's going on. Okay, here's some other forms of stress, especially recently with the pandemic. We all heard about the COVID-20, right? The 20 pounds that most people gain because it was stressful. It's still stressful. There's areas that still aren't open. There's places that you go out and you're like, well, I don't know how they quarantined or how they sheltered in place. And so your stress could potentially be going up because you're interacting with people again. And yes, we crave that interaction, and yet we're still hesitant in certain areas. Oftentimes when we're stressed, we turn to things like medication, alcohol, overeating. And these are things that we don't want to do because these become crutches, which then can become more of a problem, and we don't want to do that. I put this picture up, and I hope you can see it okay. It's a picture of the body. And I do this because it shows these different areas. High blood pressure is caused by stress. Low sex drive can be caused by stress. Your tense muscles can be caused by stress. Most every disease state, ailment out there has a component that stress has either affected, caused, or exacerbated. And so you often hear people who are having, you see fertility problems. Often when younger men and women are trying to conceive, when they're, I think most of our age group is past that, but we have these issues of fertility problems. That's actually usually a stress problem. Take the stress away and they're able to conceive. That's just an example. These are different things. So just keep in mind that the stress affects all areas of our body. The best thing we can do is learn how to manage that stress, whether it's family, finances, our work, our health causing us. And so I want to just give you a brief story of one of my clients. We're going to call her LJ. And she actually had several GI issues. So we gastrointestinal issues, having problems with diarrhea, constipation, back and forth, in and out of the doctor's offices, given pills, not working, given this, given that, not working. And so when she came to me, we had to go through and we did several different assessments. We looked at several different things. And what we did was we actually started peeling back those layers. So you say, take an onion and you peel it back one layer at a time. And we started peeling back those layers. And finally, we got down to what was causing that issue. That issue was actually some stress from some previous trauma that she had went through. And working with me, we were able to find her way to manage that stress so that she's actually now not having those constipation and diarrhea issues, and she's actually doing a lot better. So I like this picture because the plant is coming up through the crack. And as our bodies become stress resilient, because we've learned to manage our stress, we have the ability to handle what comes our way. And so when you've got to run out and jump in front of that bear and push it off, you can do that. When dinner is late because you got stuck at work, you learn how to handle and you learn to decide, okay, I'm not going to stress out about this. We're going to do it a little differently. And then you're able to keep your stress response down. keep your hormone levels and your cortisol levels down, and live healthier and happier. So why your health matters. We're going to talk about a little bit about the different types of health. And I want you to let me know, what do you think is the leading cause of death in women? Go ahead and put it in the chat. I don't know if I can see the chat. Oh, I can't see the chat.
I can see it. Heart disease is what we're getting so far. I'm typing mine in. It's heart disease. Trisha said yes. Cardiac issues.
You ladies are super smart, because that is right. The number one killer of women is heart disease. Most people think it's breast cancer. Cancer is up there on the list, but yes, heart disease. 1 out of every 5 women will die of heart disease. There's 10 of us in this room. That means 2 of us. Those aren't odds that I like. So I'd like to change that. So let's do that by talking more about your health. And we do that by educating you on different ways to manage your stress, to shift your mindset, to realize that there's more to health than just your physical well-being. It involves mental, spiritual, and physical. And when we're talking about physical health, we hear that. We get physical education in school, or I think we used to. I think they still do. Wellness of the body. And you may or may not have had a nutrition course. Strength and flexibility. We learn to balance. I can remember I had an injury back in high school, and I was rear-ended, and I had some issues, and I had to go see a physical therapist, and they put me on this ball to see if I could balance, because guess what? The balance in the inner ear, those go hand in hand, and we don't think about that always. We often think about our weight, no matter where you're at, high or low or right on. Sleep, physical health as well. These are things that we can improve and make better. Medicine is movement. I say this because you want to still be, at least I do, I hope you do as well. Let me know in the chat. When you're 90 years old, would you love to still be able to run up and down the stairs, to carry your own luggage if you needed to? You're probably going to be having valets and all of that. But if you needed to, keeping that movement, keeping that functional movement, keeping your bones and your muscles and your nerve endings agile so that you can continue to move, I think is great.
Yes, I will be carrying my own luggage up the stairs. I will be that strong.
Good. That's good.
Right, Mary? Yes.
That's great. That's great. And then we also have to remember mental health. And we often hear mental health and we turn away because we think it's a disease. And let me tell you, it's not a disease. Mental health is your well-being. We don't get this in school. We should. They should teach us how to be more mindful, how to go through and handle our emotions, or allow, not necessarily handle, but allow all of our emotions to be seen. It's okay to be angry. It's okay to be happy. It's okay to be sad. And we often as a society get shoved away when you're crying, or, you know, somebody might ask, are you okay? But then they're like, well, why are you crying over that? And these are just stigmas that have been placed on us that I want to get rid of. And so we're going to call it mental wellness from here on out. How we think, how we feel, how we manage and handle that stress. Our mind is affected by that stress, whether it's the dinner that's late, or you're stuck in traffic, or something didn't happen right. Brain fog, you get that migraine, then you hit fuzzy. Inflammation can affect your mind. Yes, it can. Inflammation is anytime you're in pain, you're inflamed usually. The pills that we take, anti-inflammatories, if you've heard of them, they're pain pills, and that's to reduce the inflammation of that pain. Now, inflammation can cause all kinds of different things, and we don't have enough time to go into all of that today. But just think of all of these things. We talked a little bit about the gut earlier. When your gut's not right, it can affect the way that you think, the way that you feel. And so we want to make sure that you are functioning at a high level and you understand your mental wellness and your mental clarity. A little bit about the gut. So the gut does communicate with the brain. We have what's called neurotransmitters, which are, let's see, a fancy way to say this. They're hormones that are produced in your gut that are also produced in your brain, and they help regulate those responses, that stress response, your immune function, digestive response, the weight gain or weight loss. And when you're feeling good, you're like in balance, everything goes well. But when you're out of balance, you start that feeling of, well, I may be a little sad, maybe I'm hungry, maybe I'm confused. And those feelings, you feel those in your gut. Now, the third one is spiritual health, sometimes called emotional health. And that's the wellness of your soul. And realizing whether or not you have a higher power that you talk to. When we think of faith and beliefs, we often think of the church setting, but I want to tell you that faith and belief is also in yourself. And so having that faith and belief in yourself is vital. What you have grown up with, morals or ethics, what is the meaning of life? People ask that. What is the meaning of life? That's kind of a spiritual thing. And we want to have a good spiritual mindset. So how do we speak to ourselves? If we're saying, you're great, you're awesome, guess what? It's true. If you're saying, I can't do that, or I can't do that, that's also true. And that's not a good way to talk to yourself. So you always want to uplift and talk well to yourself, just like you're giving a compliment to your best friend. You want to give that compliment to yourself. Self-love, making all of these three, your physical, mental, and spiritual health, a priority. And I want to tell you just a brief story about Elsie. And Elsie came to me, and she wasn't taking but one medication. And she came in, and she wasn't feeling quite right. She had a few digestive issues, but her biggest thing was she was down on herself all the time. She kept saying, oh, I'm clumsy. I don't do this. I don't do that. I fall down all the time. I'm not worthy of that. So it took a little while, but what we did was we changed her thought process, and I gave her the tools, and she did it on her own. And she was able to come around and realize that she needed some self-love and some self-care in her life. And by doing that, she's now able to say good things to herself, and she's not having those accidents and things that she was having. So the root cause, what is the root cause? So sometimes I put these kind of other definitions. A problem solver usually gets to the root cause. Solution provider, that's another way of looking at problem solver. And troubleshooting. Now, earlier this week, our ice maker was leaking. And so my husband, we kept looking on the phone like, why is it leaking? We couldn't figure out exactly why it was leaking. So what do? We started troubleshooting. And as we were troubleshooting, what we found out is that I hadn't been using as much ice. And so what had happened is actually the flap for where the ice comes out had gotten stuck open a little bit, and a little air went in there. And then what happened is that hot air started allowing the ice to melt, and then it formed a little crust there. And so it would start dripping and dripping and dripping. But what we had to do was we had to triage that. We had to figure out, okay, it wasn't the water filtration coming in, everything else was working fine. So getting to the root cause is often a troubleshooting. You take your car to the mechanic because you hear that clunking sound. They're going to troubleshoot it and hopefully get to the root cause. What happens when you go to see your physician is that typically you go in and you say, I have a headache. And they say, okay, here's some ibuprofen, go home. What they don't do is get to the root cause of the problem. And I'm going to talk a little bit about that. Oops. First, we're going to talk about the medications that they give you. So just by a show of hands, who here in this room has taken a prescription medication, over the counter, supplements, vitamins, herbals, just any of them, show of hands. Okay, looks like most of us. Why do we do that? We do that because either our physician told us to do it, we went into the pharmacy and the pharmacist said, hey, try that over the counter thing over there. Or our friend or our neighbor said, hey, try this, right? Because we wanted to feel better because we had a problem. And that's fine to start with. But what happens is if we just keep masking that, then we're not getting to that root cause. 4.5 billion prescriptions are filled each year. That's a whole lot of prescriptions, right? That is, on average, probably, I think the average number of prescription medications today is about 8 per person. And I tell you, I don't take 8. I don't want to take 8. And I hope you don't either. If you're on that many, let's talk later. Fun fact, when you go see your physician, they only had about 600 hours of medication training, and they're writing those prescriptions for you. So just food for thought, think about that before you just take everything that they tell you. So let's get down to the root cause. I'm going to tell you a little bit about my story. And so healthcare provider, top of my career, very successful. And I started having these issues. And so I couldn't breathe. So I went to see my physician, went to see another physician, kept getting to specialists, kept giving medication. And so I'm the good little steward. I took the medication. It didn't work, so I quit taking it. And so I tried and tried and tried. Finally, I got to a physician who actually helped me diagnose and get to the root cause of my problem. What I needed to have surgery. And the root cause of my dilemma was actually stress. And if they hadn't done that surgery, I wouldn't be here with you today because I couldn't breathe. It was closing off my airway. And we hear this, and you may have a similar story. You may have gone to doctor after doctor, physician after physician, and not be given the answers that you want. You go to your friend, you go to your neighbor, you go to your family member, and you say, well, what did you do with this? What did you do in this case? Now that may not be that may be worked for them, but they may not work for you because each of you is unique. And just like mine showed up as not being able to breathe, yours could show up as a headache or a rash or something else, GI issues. And if we can get down to the root of the problem, take away those layers, get rid of the Band-Aids, then you're going to be able to live healthier and more vital. Sleep is often the root cause of a lot of problems. We're not getting enough sleep. When we sleep, our body actually goes through certain cycles, and cholesterol is synthesized at night. Now you might hear cholesterol and you go, I don't want cholesterol. Well, cholesterol is necessary for your body to function properly. Yes, we get concerned when your cholesterol is too high or too low in cases of your good cholesterol, but cholesterol is necessary. And if you're not getting the sleep, that particular process is not happening. Our brain needs a reboot. Just like our computers need to be rebooted from time to time, our brain needs to be shut off and turned back on. And that happens when we sleep. If we're not getting sleep, there's potentially an underlying problem to that, and we need to figure out what that is. Constipation. I know, not a topic many of us want to talk about because it's not fun to go and tell your friend, hey, you know what? I'm constipated. That's not a conversation that usually comes up, right? Now, for me, I hear that more, which is great because that's what I do. I help you get to the root of the issue. And constipation, especially in women, it's something that we don't talk about, but it's something that can be a challenge for us. And I put two things on here to kind of help me remember. Does anybody know what I mean when I say pelvic floor? Okay, so the pelvic floor, those are your muscles in your pelvic floor. And those pelvic floor muscles, they can become dysfunctional. And when they become dysfunctional, this can happen in both men and women, that can impact how our bowels are moving. That can cause us to experience constipation, straining, different things. There's other things that go along with that as well. One simple tip, a potty stool. You're probably thinking, oh, a toddler? No, I'm talking about a potty stool for adults. And what this is, it's like a little step stool. They actually sell them in some stores, and they're called potty stools. You can go to Lowe's and get you a 1 foot Rubbermaid stool, a step.
Trisha just put it in the chat. It's called a squatty potty.
Yes.
Yeah. So I think you can buy them online too. They're awesome. They just like wrap around your bottom of your toilet.
Yeah.
Yeah.
And what it does
life-saving. It's life-saving.
Yeah.
I'm just going to interject. Sorry, but I have like all these weird curvatures in my spine, and I have, bone spurs, and I, just things, right? And so it tends to create an issue. But using it, like it relieves that pressure and it allows for the digestional tract to work properly.
That's exactly right. So
Right?
yes, it
won't
does.
go into any more.
It's one of those things you didn't think you were going to hear that today, right? But yes, it does. It helps your body align and position, and what it's lifting your feet and getting into that area so that basically things can slide out nice and easy.
Hey, lead up for women, Melissa, we are not afraid to talk about the things that need to be talked about. Let me just tell you that right now. We're not afraid. We'll talk about it because it's got to be talked about, right? If you're having
That's
issues,
right.
how else are you going to get to the root cause and fix it? Yeah.
That's right. That's right. Very good. Very good. So sometimes the root cause is self-care. And so we talked a little bit earlier about how we talk to ourselves. Sometimes we need to give somebody a hug. Sometimes we just need to sit with a warm cup of tea. Tell someone you love them. When we're in balance, things are working correctly. They're in alignment. When we're out of balance, they're not. When we're doing everything right, we think we are. We're eating correctly, we're moving, we're doing our meditation, but we still don't feel right. There's an underlying problem, and we need to get to that root cause. And so, wouldn't you all like the chance to live and really live and not be stuck with pills or potions and all of these other things, right? Show of hands. Who wants to really live vitality? Yes, everybody. Good. Okay. So how do you do that? Okay. So the time is now for you to take charge of your health. You can do that. Here's a couple of quick tips to get you started. Some meditation. Like, oh, what's meditation? Well, meditation is as simple as sitting and breathing. If you can sit and breathe for 2 minutes, your heart rate will go down. It can decrease chronic pain. It can improve cognition and help you live longer and healthier. I have a quick in the moment stress relief breathing exercise. It's 12 seconds. You breathe in for 4 seconds, you hold for 4 seconds, and you breathe out for 4 seconds. And that also will calm your mind down and help you get that clarity so that you can run and chase that bear if you need to do that, or whatever it happens to be, you're stressed in that moment. Okay. So we talked a little bit about self-care, and I say self-care equals healthcare. Now, I've been in the healthcare system for over 26 years. I've seen the good and the bad. We have some great healthcare for acute problems, emergency medicine, if you break your arm, things like that, orthopedics that are that acute. But otherwise, it's pretty much sick care. And who wants to be in sick care all the time? I don't. You don't want to go to sick care for your chronic conditions. Let's see if we can eliminate them by getting to the root cause. So we can start with some self-care, listening to our body, getting quality sleep, getting enough sleep, water intake, looking at our hygiene. Each of us, we get up, we brush our teeth, we wash our face, we brush our hair. These are things that we do to help our self-care. So there's some other things that we can put in place as well. And a friend of mine told me that we want to be seen. And this allows us to know that we're not alone in the struggle. And I struggled with this for a while. I didn't want anybody else to know what I was going through. And yet, when others know, they will relate because they have something similar. And so, don't be afraid to not be seen. How you feel affects everything. We've all heard the saying, if mama ain't happy, nobody's happy. And that sets the stage, that sets the mood. And that's true. How we feel, if we wake up and we say it's a great day, you put one foot down the floor and the next foot on the floor and you're saying, thank you, God, for this day. You're going to have a great day. If you wake up and you're like, oh, I hurt. You can turn that around. That still happens. But how you feel affects everything you do. And it sets the mood for everything. So I ask you, what price would you put on your health? And yes, it may seem costly to be healthy, but if you look at it and you actually calculate the ROI, which is return on your investment, you invest in yourself now, no matter where you're at in your journey, it's going to pay off in the long run. Less medication, less hospitalizations, less issues. So today we have learned what is stress, why your health matters. We talked about physical, mental, and spiritual health. We talked about the root cause. I gave you some examples of some clients of mine, my story. So what is your next step? And your next step is to imagine what life would be like if you could feel better. You could find the root cause. Are you ready to eliminate unnecessary medications and supplements? Are you ready to have the health and lifestyle you want? Say yes.
Yes.
Okay. Yes, everybody wants that, right? So the time is now. And what I have for you is I want you to book a call with me today so we can get to your root cause. And I'll throw this link in the chat. But if you go to askdrmelissa.net, I have a special for you ladies who are watching today. And it's on that page. A 30-minute call with me usually is $124. And so for you guys watching today, ladies watching today, sorry, my Midwest came out with the guys. For you ladies watching today, I have a special. It's only $97. If you want to start touching the brink, I also have an option. You can go ahead and book a free 20-minute call with me. Get your foot in the door. We can figure out and we can start getting to what is the root cause. You're unique, and we want to make sure that each of you can eliminate unnecessary things in your life that aren't serving you, that aren't allowing you to live vitality. So I know I finished a little early, but I wanted to make sure and have plenty of time for questions that would come up, and see if somebody has any questions right now.
Yeah, I just want to make a comment because you guys all know Mel, who works with me, Mel Carr, and she was in a terrible accident when she was a child and has been taking injections in her foot and in her ankle by her, like has to do it every day. She was always carrying around this injection stuff, and she just thought it was going to be her whole life. And then her and Melissa started working together, and she just hired her to go into more depth to really help her eliminate things that she's putting into her body that are causing issues in other areas that she didn't know. She just did it because that's what the doctors told her to do. So I love that, because no matter what we're taking, right? No matter what, I was taking a crap load of supplements. And then one day I said something to Melissa. We were on the phone about turmeric. She's like, I hope you're taking that with pepper. I was like, am I supposed to take that with pepper? I didn't know that. So if you're just wondering, like, what am I taking, what I need to be taking for my body? Are these medications that doctors are giving me right for my body? It's a great opportunity to take Melissa up on a call, just like Trisha said, because she's really great, to be able to just dissect and diagnose. I have been healthy my entire life, and it wasn't until I started dissecting and diagnosing what was going on in my body, what I was taking. I was overspilling way too many supplements that I didn't need to buy that were in my body. So once you really get it tuned in, then you don't ever have to go to the doctor. We're good to go. It's just about getting yourself tuned in. And I think we all deserve that, especially at this age, to just really know that we're doing what's right for our body. So thank you, Melissa, for putting that link in there, which will take you to the page for them to choose which one they want to book with you to be able to have that time to discuss what's going in their bodies. I think that's important for all of us. What questions did you guys have for Melissa? You can take yourself off mute. You don't have to put it in the chat. Anybody? Mary.
Melissa, typically what's the most common thing people say that they're stressed about?
The most common thing, I would say, it's a toss-up between finances and family. Because business, I guess. We each want to have everything perfect. And in order to have things perfect, often those cost money. And so then we get stressed out because we either don't have enough to buy what we want, or we're working too much. We have plenty of money, but then we're working too much and we don't have time for our family. So they kind of go hand in hand. And then I would say health actually does probably rank up there a little bit. People are becoming more aware of their health. They typically don't get stressed about their health until they don't have their health. And what I would love for you to do is to take action now before you don't have it. Because once that day comes, yes, you can come back from most things, but not everything. Sometimes that heart attack, you may not come back from. And in America, every 40 seconds, an American is having a heart attack. That's not acceptable.
Yeah, I like that if you don't ask, you don't get, right? So you got to ask, you don't know. And I've had to do that with my health because I don't want to go to the doctors and I want to be healthy, but what we think might be healthy versus what really is healthy for our body, there's a lot of movement, a lot of nutrition, and it starts with knowing where we're at, right? Once you know where you're at, then you can start eliminating and doing those things. And that's what I love about Melissa, because she helps people that are on diabetic medications and blood pressure medications and people that are just downing pills and pills that doctors are telling them to take to combat a side effect from the other pill they're taking.
Right.
This is the craziest thing I've ever heard, right, Jean? It's
Yeah.
like, what the heck? Yeah,
I
go
know.
ahead.
I was going to say, and what are your thoughts on like bone density issues? Because I was unfortunately diagnosed with osteoporosis. Went in, so I saw a functional medicine doctor in the morning and then went and saw the regular endocrinologist in the afternoon. And the endocrinologist says, well, I want you to take a daily injectable. I'm like, okay, do tell more. She said, well, it has a black box warning. It can cause bone cancer and give you an arrhythmia. I said, no, thank you.
Exactly.
I was like, and I mean, I have a history, 10 years of cardiac arrhythmia. It mysteriously came 3 ablations later, and 6 years later, it mysteriously went away. So I'm off the meds, but I had to do what I had to do to survive. And I don't ever care to go back that path.
Exactly. Well, and you, Jen, you went through the trauma of the system, and, and going through that. And with bone density, I'm not fond of those particular medications that have come out because there's not enough data on them.
Yeah.
And yes, those terrible black box warnings. What that means when they put a black box warning is that those side effects that can happen are extra detrimental, and you have to agree to that warning in order to take it. What that does is that kind of releases your physician from being liable that they put you on that particular medication, which that to me, the Hippocratic oath, do no harm. And I took the same similar oath. My oath is right over here. That doesn't jive well with me. And so there's a lot of different things with bone density. And you saw my little guy running. Movement is very helpful to keep your bones healthy. And now if you're already to a certain point, so your number's already a certain point, we can talk about, okay, what do we need to do next? Is there supplementation that we need to try for a little while we're getting you to be able to move more? And certain types of movement may be more beneficial than other types of movement because of the way that our muscles and our bones work together. Not everybody's a runner, so those are different things that we need to look at and look at those other things. I mean, you particular, Jen, you have a history of cardiac things that happened and then went away. So those are things we have to take into account when we're looking at what is the best solution for you now.
Yeah. And I was sitting there going, really? And I talked to my dentist. So the functional medicine doctor said, and talk to your dentist. And he was like, oh, please do not do this. Because he said, once you go on these injectables, the half-life, is that the right word?
Yep.
It's very, very long and it never really gets out of your system. Yep. So if you have to have any tooth extractions, I'm going to have to send you to a oral surgeon. So my neighbor's an oral surgeon who then said, oh, well, I'm seeing women come in here who have the same bone density in their jaw, like if they'd gone through radiation, then sending them to hyperbaric oxygen therapy.
Oh.
And so what happened a week and a half ago, luckily I never did any of this because all of a sudden I have tooth pain. I had cracked a tooth because it's an old filling. And now I'm going in for a root canal, but the doctor, endodontist, had said, if you'd been on any of this, we'd be having a very different discussion.
That is so true. And we don't always think about our teeth and that jaw.
So I'm in your camp. It's like,
yeah,
I'm sitting here collecting information and I'll figure it out, but I'm not jumping the gun.
Oh yeah, you should definitely get on a 20-minute call with
Yeah.
Melissa just to talk all about your stuff and what you've taken in the past and what what you're taking
Yeah.
now. Because I remember when I had issues way back, we're talking years ago, breastfeeding. Like who can ever remember that far back? But I was given natural ways to dry up my milk because I was producing enough milk for about 20 babies. I could sell it on the black market. So it just wasn't a normal thing. And I was in a lot of pain and my children couldn't eat very well because it was just the more I pumped, the more I made. It was really bad. So I had to use a lot of natural ways to be able to dry that up. And I didn't want to use any medications because they weren't good for the baby. All these things that they want to put you on that have all these side effects. And I went the natural way and it's worked for me and all my daughters ever since. I would never go back. So I think when you think about Eastern medicine and how they've been able to heal their bodies naturally for so many years, yet it's a, $1 trillion business for pills. Do we really need them? And maybe we're taking a pill because instead of doing it in a hard form, that we could eat during the day, we're taking it in a pill form because it's a little bit faster and easier, but it has to be the same, ingredients, right? It's got to be the same soluble ingredients. And so that's where I utilize Melissa to help me because I don't know those answers. I didn't go to 52,000 clinical hours of being a pharmacist. And to me, when I first met Melissa, it scared me to death that I was like, pharmacists, they have way more
Oh, they do.
they know way more about medication and they're the ones filling it when the doctors are prescribing it and they don't know crap about it. It's so crazy to me that it's backwards. And so having someone like Melissa in our camp here in Lead Up for Women is just brilliant. It's great. Because pharmacists they're smart. They know what they're doing and they know like this doctor shouldn't have prescribed this with this other medication you're taking. Like that's going to kill you. And I had one of my guys in my workout group that I used to train when I was a personal trainer and he did almost die. He went to the emergency room because one doctor prescribed something didn't know another doctor did.
Yeah.
And it almost killed him. So you can't rely on other people like that.
You got to be your own advocate.
Not for
I am
your
so in the camp of the mindfulness because when this whole thing came out with COVID and the stress of, oh my God, what if I flipped out of rhythm? And I worked myself into a panic, but I met some folks, started working on mindful breathing, my mindful oil, and just got myself rebooted. I am so about that. That's been a game changer.
I love that. Did anyone else have any other questions before I popped the link in for next week?
Gotta
It's
save
going to
it.
be Tracy Pullman. You guys can click on the link and sign up for next week. We're going to be talking about how to create a style you love that's simple and cost effective. For all of us that are just not wearing shoes at home at all, we got to get back out into the world and we're starting to get back out into the world. Everything around Arizona has been open and has been open forever. And so I still have to wear regular clothes when I go outside. Nothing's changed. No one's out there in sweatpants. So knowing what we should wear is great. And Melissa, just want to thank you so much for just kind of your honesty that you brought today in sharing, what it is that you do and what you stand for and what you're behind. So thank you for bringing your genius to us today and helping so many of us here. I also stream this live to the Lead Up for Women business Facebook page. So if any of you wanted to share this video with a friend that you think might need it, please go out to the Facebook page and share that with them if they need it. And Melissa, you can always drop your link in that Facebook page in the comment sections as well. So there's been some ladies out there watching it today while we've been on here. So that would be great.
Great presentation, Melissa. Thank you. And I'm heading out of town for a couple of days, but I'll do follow up with you when I get back.
All right. Awesome. Thank you for joining us all today. Thank you, Mary. Bye, Mary Ann. We'll see you guys.
Bye. Thanks.
Bye-bye, everybody. Have a wonderful week.
Save
Take
the
care.
chat.